Hello, we've got a nice, good challenge today. Someone we didn't feel like we should wait 2 weeks for the conference, so we thought we'd just video it while we're here. This is an 82-year-old patient with angina, an abnormal stress test, who has a very interesting anatomy. We'll show you here. She was sent to us for left main intervention. The LAD is very calcified. Distal left main obviously involves some involvement of that circumflex, that large diameter circumflex. There's a lesion distally in the circumflex, but the majority is the left main. I think the lesion in the LAD does extend past that diagonal. I think we're going to want to stent that. That's what I like the panel. It'd be nice to hear what the panel thinks, but I think we need to stent that. We could also do IVUS, but I'm going to just rotoblade right down past that, that first diagonal. We considered CSI. We could do, I think, either in this case. I'm going to try the rotoblader. So we've got a 1.5 burr here. We've given heparin. Can you give me a little test here? Just want to make sure this isn't going to jump forward. Good. I'm just going to start burring. And goes really easily. Test there. I feel something here. There you go. I think that's it. All right, let's give a test. You ready to inject? Inject. Hard shot. I didn't hurt anything. That's good. Now, you know, you could argue we can go bigger. I think we could have a discussion about that, but I'm not going to. I'm going to see what happens with balloons now. So I'm going to pause the tape, put a wire down the circumflex, and start ballooning. So here we are back. I've got a wire, a wiggle wire down the LAD, and a BMW down the circle. Test there. That's going to look like a pretty good place to start ballooning. I've got a 2.5 NC balloon. We're just going to make sure we got it in the right spot. It's a 20 millimeter balloon, so it'll be good. It'll be a good measuring stick. So we know we'll need something bigger than 20, probably closer to 30, maybe even longer, because it doesn't really get better. It doesn't really get big again. We're going to need a long stent, maybe even a 38. Let's take it down to here. Just there. That's where we're going to want to stent till, right? So let's take it up here, 10, 12, 14, and down. And then we're going to make sure that we get full balloon expansion, which it did look like. So if we say we want to go to test here again, if we want to go from about here, and let's pull it back to about here, that would be a 40. Test there. It's a bit much, right? So maybe a 34. Okay. Let's take this stent balloon and test there. Take it up there, 18 and 20. 24. You see I'm getting really good expansion. Down.
Down 20.
So I feel pretty good about this. Now I got to figure out what length, what diameter stent to put in. We could use IVUS. Ready to inject here? Make sure we don't have a problem. Hard shot. Okay, good. So we've dissected it. That's okay. It's going to be a 3.0. You know what? I think we have to go even further than we went. Just looking there. Mm-hmm. All right, good. Okay, so now I'm back with a 38. This is through the wrist here. I've got a wiggle wire that it's over. Let's see if it's going to go down. This is a Resolute stent today. It's going down nicely. Okay, test there. This is going to be about perfect, I think. Inject. Okay. It's a little short, isn't it? So what should we do about that? We could even, well, we may just have to accept it and then add something to it. I'm just looking proximally here. We could obviously go down further and put a different stent, proximal or distal. We can go, we don't have much proximally, you know? If you look at this, you really don't have much room to move. Let me see if I can, I always hit the wrong button there. Here it is down here. And it just doesn't look here. Let me just get this going there. Yeah. It doesn't look like we have too much room. We're going to miss it proximally. You see that with the stent? You see the stent is there? So I think I'm going to take it here, and then I'll probably just have to put a shorty down below. I don't like to do that, but I think it's the best thing here. Test again. Okay, take it up there, 10. 12, 14. Okay, down. So that looks big, actually. So the next stent in, distally is going to be probably a little bit smaller in diameter. Let's test here. Didn't look good. Okay, ready to inject? All right, so what we want now is just, let's take a 275 by 8. Let's secure the distal while we can, okay? I did have a little trouble getting the stent through, the other stent test there, but the wiggle really helped. I kind of adjusted the wiggles. So now I want to make this have just a little bit of an overlap here. Inject. Is it not long enough? It doesn't look like I'm overlapping. Am I far enough down? I think so. Maybe I can go a little further down and just make sure we're overlapped. Inject. Okay, take it up there, 10. I was wondering about a 12, but I think it's okay. Yeah. 11. Down. And then I'll pull it back about 2 millimeters and really go to high pressure with this. And then I think that'll prevent a dissection distally and get us good. Here we go. Take it up there, 14. This is NC, right? This balloon? NC balloon? Oh, the stent. Good. Sorry. Go to 20. Just and you can see that the stent is not fully. Come on down. You can see that there's a little bit of a divot there, isn't it? Let's see if we can get that. Take it up there to 15. No. All right, so let's go up to 15 again. That was interesting. My controls flipped over. That's what happened there. 18, I think it's good. 20.
18.
Yep, 20 and down.
Okay, down 20.
5704. Ready to inject? Looks pretty, huh? All right, so I'm very happy with that. Now I got to go do all the work approximately. First thing we'll do is pot with a 4.0 balloon. So this is a 4.0 balloon. I've got it in the LAD. We're not going to inflate it, but it's going to do stent viz. I just wanted to see how that does. Look like we could probably get that stent bigger. And I don't know if you'll see stent viz, come to think of it, on the video. You don't. Actually, it looks pretty good on stent viz, but I can see the conforms of the stent. You know, you can see the stent narrow, and it's looking really good here. I just don't know how to show you that as a one-man recording here, but that was helpful. So now we'll just go and pot the proximal vessel. We'll do that, making sure we have this in the right view. And actually, you know, stent viz will be helpful here too. Can you go on stent viz? Yeah, this will tell me whether, go ahead and hit it. This will tell me whether our balloon, which is going to do the pot, is right at the ostium of the stent. You can see it even before the computer does its thing usually. See, that looks like it's pretty perfect. I hit it perfectly there. And the computer is doing its thing now, and perfect. Perfect. All right, so let's take it up there. Let's go to 10. I don't go too high because we're in the LAD here.
10.
All right, 12. All right, down. Now give me another BMW. I could use the same BMW, but I'll spring for a new one. Make sure everything is okay. Patient's doing great. Let's get a picture here. Make sure we have flow in that circ. We certainly do. Okay, now we'll work in the other view for the most part. So it was a little difficult crossing this, but I think I got it here. This is the new BMW. I want to show you something. We really have an interesting question to answer right now. Let's get this to go down the vessel, which it may go. All right, there you go. Okay, and I'll take out the other one. Make sure I take the right wire out. Good. So this one's now through the stent struts. So let's take a picture. I want to show you something here. So what do I do? I mean, it looks darn good. I think the DK Crush 5 study indicated another stent might be better here, but I'm not so sure. This really does look good. So this is where I really enjoy having the panel give me some advice, but I'll do an FFR here and we'll let you know, and I'll also do some IVUS stuff. All right, so we are equalized, and This is the assist. We'll see if it goes across the stent struts. Boy, going across easily. So this is catheter based, and we'll leave it here. And it goes down to 0.97. So we'll start the adenosine. I don't think this is going to be a problem, though. I'll pause the camera. So we're back, and we got an FFR 0.91. I'm going to go back to and it goes back to 0.99. So we're good. All right. So I think I'm going to leave this. I'm going to leave this Circumflex. I will do some IVUS on both limbs if I can. Then, so let me report back on that. All right. So the IVUS the LED was perfect, but I didn't like the very ostium of the stent in the left main. I thought that could be just a little bit bigger. So we have now a 4.5. Let's take that 4.5 up to 10. Got it placed perfectly using stent viz. 12, 14. And I think that's good enough. All right, let's see that. Down.
Down 14.
Okay. Hit that button. Let's see what we got here for pictures, and then we'll IVUS, if we can, the Circumflex. Okay, so now we could have made the Circumflex worse now, right? Let me get the guide in here for you. Sorry, hon. Ready? Hard shot. Yeah. We may have made the Circumflex a little worse. I want to move the screens a little bit here so I can get probably not. You ready to inject again? Might have to repeat the, nah, looks fine. All right, so I'm going to see if I can IVUS that Circ now. I'm very happy with this. So I'm using the IVUS. This is a short monorail IVUS. This is the assist IVUS. I want to be very careful because if it doesn't go easy, I don't want to do it. See, it's not going easy. And you can get these things, well, now it went easy. You can get these trapped behind the stent, and then the nose can rip off. I've had that experience. Not very exciting. So I'm going to IVUS this. I can't show it to you, but I'm going to IVUS it. Well, this has been really interesting. I wish you all were here. I just repeated the FFR, and it's I put the FFR wire down further, or the catheter down further, as you can see, and it's 0.91. And I don't know how to explain the fact when I do an IVUS through here, it does not look good. We have a minimal luminal area right about here at the ostium, right where my dot is on this FFR catheter. The luminal area is 1.5. And there's another tight area down further, down right about there. So I can't really explain it. Let's take a picture, right? But I feel like I should treat it, even though the FFR is 0.91. So I'm going to put one long stent. I think I'll just do a T. It's easy. All right. But it would be great to have opinions on this. There. Just there. Let's dilate the stent struts. Take it up there to 14. And down. And then we'll just see how much longer and what kind of length stent we want. Test there. This is the area we wanted to get right up to that branch. Take it up to 14 again. And down. And so it looks like two of these. This is a 12, so probably, 20-ish, 24 would be good. Let's take a picture. All right. Okay, so what I've got now is a stent, a 18 millimeter stent, poking through the stent struts of the left main stent, going down the circ, and a backstop balloon to do a T-stent. I have to say, I really don't understand why we're getting disparate results between the FFR and the IVUS, but I'm going to go with the IVUS. I just don't want to leave, test it. I don't want to leave a tight stenosis. Let's just make sure can we go on stent viz? I wonder what we'll see, if anything. Let's just try it. Okay. I think we're perfect, actually. You can see that. You can see we're perfect. All right, good. Let's take the stent up. Always do the stent first. Someone help with that? Okay, good. Who's got the stent? Open the stent, please. 10. So 3.5. 12. That's good. And now I'll do the other, which is a 3.5 balloon. I'll take it up to 16. 3, 2, 1, down. That should do it. Let's see what we got. Inject. It's about the same. It really does. I think what I'll do is do a high pressure inflation in both of them before we squid. Okay. A good kissing inflation here. Okay, let's both go up to 5. Do you want to go to 20? I'm just at 1 now. Okay, now go to 1. 1 atmosphere. Thank you. And I'm up to 20. Okay. And I'm at 1. Now let's go to 14 together. Okay, tell me when you're there. 3, 2, 1, down. I don't think we can do more than that. Okay. Let's see what we got. Okay, good hard test here. Let's see what we got. That looks good. All right, I think we're done. The one thing I want to look at is that diagonal. I might need to work on that diagonal on the LED. Hopefully not. Okay, hard shot. That looks great. I think we're done. All right, I'll take wire out shots, but we're done. I think this was a good demonstration, and maybe we can discuss why the FFR and the IVUS was different. Actually, I'm going to take a quick look at the IVUS again and make sure everything's fine, but I think this was a good demonstration. Thank you.